Yes, welcome back again to another episode of DDM Health News Updates on our usual program. Your health is your wealth. Or don't you believe so? Don't you believe your health is your wealth? I'm sure you know that your health is always your wealth. Well, as usual, friends, don't forget to click on the subscription button so that you won't miss the latest news updates on our program. You know, so they give you the latest updates. So what do you have today? Well, today we are on Colombia. Ha! Not be Nigeria this time around though. What is each country? Colombia. So, hear what is happening there. Colombian government on Wednesday, April 16, 2025, declared a nationwide health emergency after yellow fever killed at least 34 people. Oh my goodness. This yellow fever wey dey trend, oh God, abeg help us. The State Minister for Health, Galemu Afonso Jaramillo, announced the emergency during a radio interview with RCN. They are really in need of help. Oh. Colombia health officials also confirmed 74 yellow fever cases with a mortality rate of nearly 50%, promoting urgent action. Honestly speaking, actions are really, really urgent. He urged citizens to get vaccinated, especially before the Easter weekend. You know, say if they enter Easter now, this yellow fever feels spread everywhere. Gerard Milo said people traveling to a high-risk areas must present proof of yellow fever vaccination. Colombia, una don ready? Una ready, oh. Una ready because una must prevent yellow fever vaccination. That is to show that you are vaccinated against yellow fever. Because of course, the health of others, they have them in mind. The government provides the vaccine free of charge at all designated health centers. You can imagine. Wow, kudos to the governor. Yellow fever spreads through bites from infected mosquitoes in tropical and subtropical regions, which we all know. If you don't know it now. The virus can be deadly. But a single vaccine dose offers lifetime protection. So that is the essence of taking a vaccine. The minister said most cases were concentrated in the eastern part of Tolima province, that is in Colombia. Tolima is known for its coffee plantations and attracts many domestic and foreign tourists. So these are the reasons why they are mostly needed to get vaccinated. President Gustavo Petro issued a warning via social media on the outbreak severity. That means they don't use, you can see, their own president, they use their people play. He advised unvaccinated persons to avoid high-risk areas during Easter, especially Colombia's coffee zone. Officials fear increased travel during Easter could escalate the spread of the virus, which is true. Those where carry and feed spread out to other people. Yellow fever often mimics other illnesses in its early stage, complicating the whole diagnosis. So please, those also in Nigeria should take note. Common early symptoms include fever, back pain, muscle pain, and even nausea. Please go and check if you have yellow fever. Well, according to the World Health Organization, most patients recover after the first phase. Yes. However, 15% enter a toxic phase with jaundice, bleeding, and kidney failure. I noted, jaundice fit enter your eye. Half of those in the toxic phase typically die within just 2 weeks. This is what the WHO reports. So we don't take this as a joke. The Health Ministry has intensified vaccination drives in high-risk zones. So please, if you're not vaccinated, try and do so. Mobile teams have been deployed to reach remote and vulnerable communities. Colombia, so now they try. Colombians have been urged to report symptoms early and avoid mosquito bites. If you have mosquito nets, please try and make use of it. At night, try and close your doors. Officials encourage tourists to take precautions and comply with health advisories. Whatever they tell you to do, please adhere to that. The government said he is monitoring the situation and will provide regular updates. That's very thoughtful of you, Governor. Health authorities are collaborating with international bodies to control the outbreak. The emergency remains active as Colombia fights to contain yellow fever's deadly spread. You see, as the presidents and governments of Colombia are fighting for their, I hope so they go do the same for us for here in Nigeria. I don't talk anything, no. Next, the Nigerian Medical Association, popularly known as NMA, has called on the federal and state governments to urgently and end the casualization of medical doctors in public hospitals across the country, describing the practices as exploitative and a key driver of brain drain in the health sectors. Why are doctors dressing casual? The first vice president of the association, Mr. Benjamin Oluwojebutu, abeg I no be Yoruba, no vex if I no call your name well, made the appeal during an interview with the news agency of Nigeria, that is NAN, in Lagos on Wednesday. Dr. Oluwojebutu lamented the rising trend of hiring doctors on temporary, non-pensionable terms, especially in state-owned hospitals and teaching institutions, saying it has become the norm rather than the exception. Quote, abeg o. All doctors working in public health hospitals must be given permanent and pensionable employment after a clearly defined probation period. Temporary contracts must not exceed 1 year, he said. He explained that the casualization of doctors refers to employing them on contracts or locum terms without job security, benefits, or room for career progressions. Is that right? According to him, many young doctors are subjected to harsh working conditions, receiving slashed salaries with no health insurance or pension benefits. Very sad indeed, doctors. So sorry about that. These doctors are treated like disposable tools, recruited when needed and discarded without explanation. He said that. How can a government that claims to value healthcare allow such inhuman conditions to persist? This is the question he asked. Oluwojebutu decried the widespread culture of intimidation and victimization in the health sector, especially against doctors who speak up or participate in legitimate union activities. So sad. Resident doctors in many teaching hospitals are overlooked, unpaid, and face vindictive managements. Promotions are politicized. Disciplinary measures are used as weapons, and those who push back are often transferred punitively or dismissed outright. He revealed that. He warned that the systemic mistreatment of doctors is fueling the alarming rate at which Nigerian doctors are leaving the country. Abeg, we no want our doctors to leave Nigeria. Abeg. According to statistics from the NMA, over 2,000 Nigerian doctors emigrate annually, with over 12,000 already practicing in the United Kingdom alone, as captured by the UK's General Medical Council. Not be smart thing. This brain drain is more than a professional loss. It's a silent emergency. It is a death sentence for millions of Nigerians who depend on the public health system. Oluwojebutu said, if our doctors come out, who go treat us? He cited instances where entire local government areas are left without a single doctor, leading to delayed emergency responses and increasing mortality rates. Of course, who go treat us? The NMA vice president urged government at all levels to guarantee job security, respect for the rights of doctors, and improve remuneration and working conditions, adding that these steps are crucial to strengthening Nigeria's ailing health sectors. I think so too. He also called for an independent grievance redress mechanisms for medical professionals and a probe into hospitals and institutions that victimize doctors. Furthermore, he appealed for increased and transparent budgetary allocation to the health sector to ensure quality, accessible, and sustainable healthcare delivery in Nigerians for all the Nigerians. Wow, that's very thoughtful of you. Up next, Bauchi State Governor Bala Mohammed has approved the release of 872 million naira as the state's counterpart funding for the development of primary healthcare sector. Wow. Wow, 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 wow. People at the north are enjoying, the governor made this known on Tuesday during a meeting of the state task force on primary healthcare and an award presentation ceremony held at the banquet hall of the government house in Bauchi. All right. Represented by his deputy, Wow Jatu, Governor Mohammed stated that so far a sum of 261,708,491. I repeat, 261,708,491 has been disputed to the Bauchi State Primary Health Care Development Agency, reaffirming the government's commitment to strengthening health infrastructure, supporting frontline health workers, and ensuring access to quality healthcare services across all parts of the state. That's very, very wonderful. Well, this is a statement made by him. I want to express my deepest gratitude to all health workers, local government health teams, facility managers, and community volunteers who have worked tirelessly to improve healthcare delivery in our state. I'm also grateful about that. Your efforts are the backbone of our progress in the health sector. Wow. Mohammed noted that the awards presented during the event were a token of appreciation for the dedication and sacrifice of healthcare personnel. I'm so happy that our healthcare personnel are being notified, as in they are being identified, they are being noticed. Adding that his administration would continue to invest in programs aimed at improving the health and well-being of the people, particularly women and children in rural and urban areas. These are the promises from the governor. He reiterated the state government's resolve to achieve universal health coverage, that is the UHC, and assured that adequate funding will be provided to meet this goal. No be small thing. The governor also commended development partners for their technical and financial support, which he said have contributed significantly to strengthening the state's healthcare system. He called for continued collaboration to build a healthier Bauchi state. And I tell you, people at the north are really, really enjoying. Also speaking at the event, the CEO chairman of the State Task Force on Primary Healthcare and Emir of DAS, Usman Biamina, applauded the achievements recorded in the implementation of various health programs in the state and pledged the traditional institutions continued support. Well, I also applauded for this. Up next, you don't know what is happening. Katsina targets 3 million children for polio immunization. Katsina State. The Katsina State Primary Healthcare Development Agency, that is the SPHCA, says it is targeting not less than 3 million children during the forthcoming polio immunization campaign scheduled for April 26 to 29. If your children is in Katsina, please take them for polio immunization. Media reports said its executive secretary, Dr. Shamsuddin Yahaya, made the disclosure as a media dialogue with UNICEF, Katsina State. Government officials and partners on polio and routine immunization, in Katsina. Wow. During the week, he said the world would also be celebrating routine immunization. That is very, very wonderful. Ha! No person go dey suffer from polio this time around. Yahaya said that the exercise was aimed at creating awareness to the importance of immunization in saving children from preventable deaths. Please, if you're in Katsina State, try to engage in this campaign. He therefore urged the media to continue to enlighten caregivers and other stakeholders to the importance of immunization, just as we are doing here right away. That's why we always tell you, subscribe to our YouTube channel to get the latest. The executive secretary revealed that the state has 1,636 health facilities providing routine immunization services for the children. Yahaya said that the government would engage 3,700 independent monitors to ensure that each eligible child was reached during the campaign. I said again, if you're in Katsina, don't miss this. In his remarks, the officer in charge, OIC, who is also the nutrition manager, UNICEF Kano Field Office, Dr. Karanvir Singh, stressed the need for immunizing every child from the polio and other deadly diseases. He revealed that polio was highly infectious. Exactly. Warning, once a child is infected with the virus, he or she is permanently paralyzed. So please, take notes. The officer explained that every round of immunization was important. Likewise, immunizing every child until the virus was completely eradicated. I pray so. Singh said that immunization was the backbone of any eradication program, adding that hence the need for caregivers and other stakeholders to intensify efforts in ensuring that all children below 5 years are fully immunized. Also, finally, in continuation to the immunization of a teen, no fewer than 68,000 children are set to receive polio vaccines in Plateau State, according to UNICEF. This time around, it is Plateau State. The United Nations Children Fund disclosed the plan during an advocacy visit in the Gwangwan Jos, Yakububa in Jos. If I don't pronounce that well, no vex. So, Mrs. Nauzat Rafik, UNICEF Bauchi Field Officer, revealed that this on Wednesday while addressing traditional stakeholders in the state's capital. She explained that the vaccination drive would cover high-risk areas like Jos North, Jos South, Shendan, and Wase local councils. So if you're in these areas, try to immunize your child. 5 additional zero-dose districts in the state have also been marked for intervention under the fresh vaccination plan. So Mrs. Rafik said the campaign would commence with a catch-up phase before the official campaign between April 26th and 30th. So please, always take note of all these. They are essential. A second round of vaccination is also planned for December to ensure children not reached initially are covered. So if your children are not reached this time around, you might be lucky during the December time. She said, the idea is to leave no child behind, no matter how remote or risky the location may be. That's very thoughtful of them. Mobile vaccination teams will be deployed and they will operate under tight security in volatile communities across the state. Traditional and religious leaders are also expected to play a major role in mobilizing their communities for the exercise. So please, religious leaders and traditional leaders, take note. Rafik added that UNICEF is partnering with local media outfits to tackle vaccine-related misinformation in the state. Vaccination posts will be located in royal palaces to build public trust and encourage wider community participation. Sometimes if they should say all these things, people see it as a fake news. We are setting up posts in palaces and working closely with traditional rulers to overcome resistance, she noted. So there will be also weekly follow-ups in resistance communities to monitor acceptance and identify lingering challenges. That's very good. This will not be fake news this time around though. Primary health centers across plateaus will be strengthened to sustain routine immunization efforts after the campaign ends. She said the strategy is designed to close immunity gaps and build a stronger, more resilient health system statewide. Plateau Commissioner for Health, Dr. Nicholas Bamlong, described the figure of unvaccinated children as alarming and unacceptable. Very, very unacceptable. Banlog said the state had already launched an early catch-up drive in collaboration with the Primary Health Care Agency, that is the PHCA. He noted that traditional rulers, local council bosses, and community leaders are being mobilized to reach difficult terrains. So please, don't play headstrong. Adhere to the advice. He said, visible leadership from our rulers and leaders is key to breaking vaccine resistance to many communities. Of course, many communities might resist it, but please, do not. The Bangwan just assured full traditional support, pledging to summon all district and village heads immediately. That's very, very good. He promised that traditional rulers will demonstrate leadership by publicly vaccinating children and encouraging cultural acceptance. Of course. So please, adhere. Well, with these viewers, we've come to the end of today's news on your health, your wealth. If your health not be your wealth, how will you survive? Well, be sure to click on our like button, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, to get the latest info, the latest news on your health. Like you're hearing, yellow fever, polio vaccination is currently ongoing. So please, don't miss this. If you're not vaccinated, if your child is not vaccinated, try to do so. 26 to 30 in Plateau State and also in Katsina State. Please take note. Alright viewers, thanks for watching. Do have a lovely and wonderful day ahead. Until we meet again, I remain your host, Nenyer Michaelin Ezine. Thanks for watching. See you next time. Bye for now.